Good afternoon, everyone. My name is Cameron Friesen. I'm the Minister of Health, Seniors and Active Living for the province of Manitoba, and I am joined by Dr. Brent Roussin, Manitoba's Chief Provincial Public Health Officer, for this Thursday briefing. Dr. Roussin, over to you.
Thanks, Minister. Our current 5-day COVID-19 test positivity rate is 3%. It's important to note that the trend in the current 5-day positive test rate is affected by the large number of cases that are in known clusters and intentional testing campaigns in those clusters. We're also reporting an additional death today. This is a female in her 90s from Southern Health. This brings the total number of deaths to 14, and I want to extend my condolences to the friends and family of that individual. This case is associated with the outbreak at Bethesda Place in Steinbach. 22 new cases of the virus have been identified today as of 9:30. A previously reported case on August 15th was removed from the case totals. This means the total net cases today is 21, bringing our total number of lab-confirmed cases in Manitoba to 1,064. We had 3 new cases in Interlake Eastern, 9 new cases in Prairie Mountain Health, 6 new cases in Southern Health, and 4 cases in the Winnipeg Health region. There are currently 6 hospitalizations and 1 individual in intensive care, 407 active cases, 643 individuals are recovered, and the number of deaths due to COVID-19 is at 14. Preliminary investigations show that 7 of the cases announced today are close contacts of a previously announced case. Ongoing investigations are continuing. As far as testing goes, 1,429 were performed yesterday, bringing the total to 130,835. The preliminary investigations indicate that a majority of today's Prairie Mountain Health regional cases are linked to intentional testing related to known clusters and communal living communities. Investigations indicate that a case previously identified in the Prairie Mountain Health region is a healthcare worker from Rideau Park Personal Care Home in Brandon. This individual wore personal protective equipment during all times at work and is currently self-isolating. Close contacts have been identified, and ongoing investigation is continuing. This information has been shared with families, staff, and close contacts. No other cases have been identified or linked to this case, and the risk is assessed to be low. However, an outbreak has been declared at Rideau Place. The site will be moving to red, to critical on our pandemic response system. So the site is putting in additional measures, further restrict to reduce the risk to residents and staff, but does result in the restricting of visitation at the facility. There are new public health orders that will take effect tomorrow. The public health orders will require Manitobans to self-isolate for 14 days if they've been determined to be an active case of COVID-19, or if they've been exposed to COVID-19 and identified as a close contact. All individuals that this order applies to will be contacted by public health through the usual process. Once notified, the person must go to their residence or an approved self-isolation location and remain there for 14 days or as long as directed by public health. There are, of course, exceptions for things like urgent medical care, but if the person is outside their home, they must wear masks and maintain physical distancing and minimize their time away from home. Failure to self-isolate in accordance with the public health advice is a violation of the order and enforceable under the Public Health Act. Individuals could be subject to fines for non-compliance. The order will be posted online as soon as possible. We developed this order in response to some isolated situations where we determined individuals were not self-isolating as appropriate. So public health had always had the ability to take action on individuals who weren't following public health advice through the Public Health Act. This new order provides a streamlined approach to that. Again, like most of our interventions, education is preferred, but individuals who do not self-isolate as directed could face fines up to $486, and that could be assessed daily. Prairie Mountain Health region continues to be at the restricted level, orange, according to our pandemic response system. This includes the requirements to wear masks in indoor public places, and gathering sizes are reduced to 10, both indoor and outdoor. There will soon be a requirement for all visitors arriving at healthcare facilities throughout the province to wear a non-medical mask in order to be permitted onto site. This requirement will take effect on September 1st. It also extends to outpatients attending appointments at clinics within hospitals and health centers throughout the province. So this directive does not directly apply to private primary care clinics and other services, but we strongly encourage Manitobans to wear non-medical masks when seeking care. I want to note here that there are some Manitobans who will be unable to wear masks. And so again, our message of being kind to others and whether they're wearing a mask or not. We had a number of questions as we raised the alert level to orange in Prairie Mountain Health regarding schools. And so we developed that pandemic response system to be flexible and responsive and being able to target the epidemiology in an area. And so that's how we applied it in this circumstance. We raised their alert level to orange because of a number of rising indicators. The epidemiology told us that a lot of that was related to large group gatherings. And so that's why we tailored it on the large group gatherings to reduce gathering sizes, but we really did not apply the order directly to any other sector. And if you review our pandemic response document, other sectors, for instance, restaurants have what may occur when we go to orange, but it only is if we do implement that, and we haven't. So just like restaurants, retail, and any other sector, we did not apply that to schools at this time. So schools are not, in that area, are not changing their level of restriction, although our schools province-wide are prepared to do so because we know things change quite quickly. So, so at this point, we haven't affected any other sector in Prairie Mountain Health, only group sizes and masks. So we know that the education system has a return to school plan with many safeguards in it. Public Health still feels that that is an appropriate plan at this point in Prairie Mountain Health and province-wide. But like I said, the education system is preparing plans to be able to change that level of restriction should it be required. Masks. We wanted to, as we're increasing our messaging about masks and using it in indoor public places, we want to make sure that Manitobans have the ability to wear them properly. We know wearing a mask improperly will not prevent the spread of COVID-19 to others and may also put the wearer at greater risk of infection. So when wearing a mask, wash your hands or use a hand sanitizer immediately before putting on the mask. And practice good hand hygiene throughout the mask wearing period and all times. Ensure the mask fits well, doesn't gape, and it should cover your nose, mouth, and chin at all times. Certainly don't share your mask with others. Avoid touching your mask or face while wearing the mask. If you need to adjust your mask, then wash your hands immediately after. And do not dangle a mask from the ear. Do not pull it down under your nose or under your chin. This can cause some contamination to the masks as well. So do avoid touching your face, period, but certainly when you're wearing a mask. Well, medical masks can be disposed of. Reusable non-medical masks must be placed in a bag or washed appropriately and should be replaced whenever wet or soiled. We do not use masks on children under 2 years of age or on anyone that's unable to remove the mask without assistance. So we know we've seen increasing numbers, and we've been messaging about the fundamentals, and I don't think we can say that enough. We know that staying home when ill is going to be a very, very important aspect of our plans. And so self-isolate as soon as you develop symptoms, even if they're very mild. So some people have very mild symptoms with COVID-19. So be on alert, but even mild symptoms, self-isolate, go for testing. Do not go to work, do not go to school, do not go to a religious gathering. Really just stay home, self-isolate, certainly get tested or seek medical care if necessary. Same message to employers. Work with your employees to try to limit the barriers for employees to stay home when they're ill. The only alternative they would have is to come to work when they're ill, and certainly that's not what anybody wants. So work with that, decrease the barriers, plan for excessive levels of absenteeism this fall. We typically see a lot of people come to work and to school ill, and we know this fall we really have to avoid that. Employers don't send employees for testing if they're asymptomatic. That puts an unnecessary burden, and it's not a really appropriate use of our system. Continue to practice all those fundamentals we know of so well: hand hygiene, physical distancing, staying home when you're ill, mask use, indoor public places. And then again, mention the importance of stigma. We can't separate the importance of stigma from our pandemic plans. We know, and it happens, that if we stigmatize a group or stigmatize certain people, they're less likely to go get tested, right? To be worried about how they're treated should that become positive. So it's harder to identify cases, harder to do contact investigations. So it's a very important part of our plan to reduce stigma. Visit our website, manitoba.ca/COVID-19 for up-to-date information, and can open up to some questions.
Dr. Roussin, given the continued increases in clusters in Prairie Mountain and other places, in retrospect, did the province wait too long to begin widespread testing, such as mobile clinics in communal living communities?
I don't think so. Those type of clusters where we have, and we've identified a number of these cases. When you go into an area that's a tight cluster and you identify many cases, it does more to just falsely elevate the actual picture of what's going on, because everyone there in that area who is already ill should be self-isolating. They're connected to it. So I think that certainly these type of testing strategies are important. I think it's good to get people on board with it. But I wouldn't say that there was too long of a wait. I think there's been a lot of testing that's been going on for quite some time.
But on that note, why did you only conduct mobile COVID-19 testing on 2 colonies?
Well, a lot of the plans that come out are worked out with the region and communities. And so it depends on what they're seeing in the epi there and what communities are agreeable.
Point blank, were you refused entry into any?
I don't know the answer to that. I certainly wasn't, but it's
You personally?
yeah. Not that I'm aware of. I mean, I think that there's certainly a gradient where we see some communities that are following, going above and beyond, looking at public health advice, while others may not be quite on board.
Are you able to just break down for us the current screening requirements for staff in personal or long-term care facilities, and whether or not that's going to change at all now that we have 2 cases linked to staff members?
Yeah, so the screening process is essentially the online screening tool. So every staff member is required to do that every day. And then we have the universal use of PPE while at those places.
Earlier on, staff members were getting tested at the facilities before they entered, right? Their temperatures were being taken. Is there any chance that we may go back to that?
Yeah, and you know, like temperature testing is just one of those things that has just never been shown to do a whole bunch. You know, I think that you know, certainly people who choose to do it, I think it's fine. But we know that a significant proportion of people with COVID don't have elevated temperatures, and then a significant people who have elevated temperatures don't have COVID. So it's not a great screening tool. It's much better to screen for symptoms, even mild ones.
But on that note, why are workers from the hospital in Steinbach allowed to work at Bethesda Place?
Well, when we had our one site model, it's between PCHs, so we only want a person to work at one personal care home, long-term care facility, not working at multiple of those. You know, having a person who works at a personal care home cannot work anywhere else in the system. That's also a very significant strain on on human resources.
So you acknowledge then that workers were moving from the hospital part to...
Well, I don't know that specifically from there. I just know that our one site PCH model refers to personal care homes.
We are told that they were short at the PCH and bringing in from the care home, from the hospital rather.
Oh yeah, I don't have the specifics on
You're
that.
okay, and based on your first comment, that is unacceptable practice.
Right now our order focuses on people not working at multiple long-term care facilities.
The new health order, what's new there? Because I thought that you had to self-isolate for 2 weeks if you were found to be.
That's right, yeah. So it's not a whole bunch new. What happens is under the current act, if somebody was not self-isolating and putting somebody at risk, we could issue a communicable disease order, and then they'd have to violate that order. Then we would have to apply for an order to detain. And so we didn't have the ability to fine anyone. Yes. So this, rather than having to actually detain somebody, we could just use that as a lever to say that you can be fined if you don't.
Can you clearly define like close contact?
Close contact. So close contact is someone within 2 meters for greater than 15 minutes of a confirmed case. And so that's how we define. When we do a contact investigation, we look for anyone who might fit that category.
What's behind the 97 active cases in Winnipeg, to your knowledge?
Yeah, I think that a lot of them are linked to cases, but we know that roughly around 20% are community-based transmission on there. So we're going to see cases. The majority of them are people who have been self-isolating. But we do see some community transmission.
Well, why do you think 16 of the 22 new cases today are women?
I can't really make much of that on one day like this. So it's, it can be just based on just the randomness.
You mentioned that the new self-isolation rule was a result of some people not following the current guidelines or the orders. Are you able to say where that happened, and has that been linked to any clusters or?
Yeah, well, actually, in one of the big clusters in Brandon, we saw, we didn't see, but we were hearing many reports of people who were cases and were contacts, which were later at large gatherings. So it's the same thing, those gatherings that we were worry about, and that's why we changed the level to orange and to 10. But then we also saw this on a number of occasions, and so we just wanted to have this in place should that occur again.
And when you say number of occasions, do you know roughly how many times this has happened?
No, it was more just reports through it. So there wasn't a specific number of people. It might have been the same person reported many times, but it was just that it was an important enough trend in this specific cluster that we saw that we just wanted to make sure we had something in place.
How do you get those reports? Are they just phoned in, or people contact your
Sometimes
office
they'll
and say there's a party, there's a gathering you should know about?
That's right. Yeah, so we'll often hear things just even from the public.
Do you know how many confirmed cases stemmed from somebody who wasn't following the rules?
Yeah, no, we wouldn't have that level of detail. Often we might not even know the much of the specifics about that. Yeah.
So there were people that should have been self-isolating who are going out at public events.
To large gatherings, yes.
Is it safe to say there have been confirmed cases because of they were in contact with somebody who was not self-isolating?
I can say that, yeah.
Just, back to school, we've got a lot of concern about that, and, some of these questions you may not be able to answer, but, you said before parents should speak to their doctor before deciding whether the kid goes back, but what qualifies a child for remote learning at this point? We're 12 days away, medically.
Yeah, well, I mean, there's it'd be difficult to give a list of medical problems. I mean, I think what ultimately it would be if there was a medical reason decided by with their healthcare provider that it was be unsafe for them to return, then that should qualify.
So do children need a note from their doctor?
I think we'll have to ask education on exactly the process from it, but I think for a decision that would be you can't go to school for an entire year because of a medical problem, I think that should be reviewed by a medical practitioner.
Why doesn't asthma or autism qualify?
It doesn't necessarily qualify there, so I mean, I think that there's a big spectrum of asthma, and so some people have very mild asthma where they don't even necessarily require a steroid inhaler. So this is why we say we're not just sending out a list of conditions. It should be in a discussion with a healthcare provider.
Last one, bear with me on this, thank you. What if a parent or other member of the household is severely immunocompromised?
Yeah. And I think that's going to be a policy decision. I think that's going to be also a decision that might have to be discussed with a healthcare provider as well. And so the actual the details on what sort of things will be accepted, I think that's going to have to come from education. We'll certainly provide input into it.
At Maple Leaf, there's been a discrepancy between the province and what Maple Leaf itself is saying is how many cases. Have you sorted that out?
Well, I mean, I think there's a couple explanations for it. I don't know with so I have 75 total cases and 41 active are my numbers. So I don't know if that's.
So there's 52.
I know when we talked on Sunday there, we got those numbers together, and we weren't expecting to have necessarily a conference that day, so I can't speak to those specific numbers. But
So
today
75
I have 75 total.
Who work at the plant have become ill.
Yeah,
but-
and 41 are active is what I
Thank
have.
you.
So remember, when we report things out, it gets reported to us. There's an investigation, it gets back to surveillance, and then surveillance compiles these numbers. So the company might hear of someone today and just announce that, where we wouldn't necessarily announce it for another couple of days until we've gone through all the.
We're going to hear anything new on masks in the near future, like requiring masks in all indoor public places, for instance, across the province?
Well, I think that
And why not?
I think when we saw the cases in Prairie Mountain Health, we did move to that. And like I've said, is that I think it's something that we're looking at. We know that our public health interventions in the first few months, the stringent restrictions worked. And I think that most people would agree we want to do whatever we can to not have to go back into those type of shutdowns. And our only significant public health intervention in between that is masks.
So we've had readers send emails to us saying, I live in Swan River. I thought this was going to be sort of like a surgical, sort of narrowly focused, new restrictions might be more narrowly focused. They're saying, well, if it's in Brandon and other locations, why me? Why is it extended?
Yeah, and so I mean, a number of cases were in Brandon, but a number of their acquisition events were outside of Brandon, but in Prairie Mountain Health. So it was wider than just Brandon that we wanted to address. And so I think that anytime we do these things, there's going to be, question or people that, does it really involve me? And it's a fair question. I would say that this is much more targeted than our other approach. And so, but I think there'll always be some outliers, but I think we did get our goal to be much more targeted than we were in the past.
Do you think Winnipeggers are complying more with the mask recommendation?
I think anecdotally, we're seeing more and more businesses requiring it. We're starting to see that normalization take place, where if you're out in public, it's just going to be normal to start bringing around your mask. And with many businesses mandating it, I think we are seeing increased use.
Are you having discussions with the city of Winnipeg about making masks mandatory for Winnipeg transit buses?
We discussed with the partners on that, and certainly our recommendation is that in areas where you can't physically distance, we strongly recommend that, and so we've discussed that with them.
Can you explain why you wouldn't make it mandatory? I mean, they're indoor, if you're inside a bus, you're confined. Sometimes you get on a bus, it's full, people are standing. Seems to be a real high-risk environment in many cases.
Yeah, and I think it's been our incremental approach to start with our messaging, start with those strong guidelines. It's certainly mandated in Prairie Mountain Health, and so it's something that's on that we're looking at.
On the 14-day self-isolation rule, how far back do you go to consider somebody a close contact?
So we'll talk about, I think what you're getting at is the period of infectivity. So the period of infectivity is 2 days before symptom onset and 10 days following symptom onset.
Gotcha, okay.
The 14th person who died, was that person at Bethesda in ICU?
Not in ICU, it was in hospital.
Thank you, Doctor. We are now going to the telephone to get a few questions from those reporters. First up, from the Brandon Sun, Michelle.
Yes, hello, Dr. Roussin. My first question has to do with a Brandon woman who had been waiting for a year for an appointment, an important appointment, she says, for her child, which was rescheduled 3 times over the last few months. That appointment was recently canceled, and she was told that the hospital was directed to cancel all appointments out of Prairie Mountain Health, and this was St. Boniface Hospital. So I'm wondering if this is an official directive that you've applied to all hospitals in Winnipeg, or is that a decision by the St. Boniface Hospital? And what would be the rationale for that?
Yeah, so I'm not aware of this specific case, and so it's hard to comment on the specifics of it. What I can say is that public health has not given a directive to cancel any hospital procedures as an overall guidance.
Okay, thank you. And my second question has to do specifically with the Rideau Park Personal Care Home. And I think I didn't quite, sorry, I'm on the phone, so I didn't quite hear, you may have addressed this, but there seems to be a lapse. A letter went out to families yesterday at 1:30, and Prairie Mountain Health advised the Sun this morning that indeed there was a case. What are the time lapses in the protocols involved in letting people know that this is occurring?
Yeah, and so I don't know the specifics of that. I think it's as soon as reasonable. What's important with these cases is that we get the report. We'll notify an individual of their positive status. We then start a case investigation. So just from the requisition, where it's unlikely that we'll know anything about where they work, so we have to reach out to that individual. We have to hear when they, where they work, when their symptoms started, if they were in the period of infectivity. Then we do a thorough investigation. So the reporting is sort of an afterthought once we have everything in line. So close contacts would be notified as soon as we can find them, and most times that's within 24 hours. And then we'll, make a public announcement when we're certain that our investigation is accurate.
From CJOB, Diana.
Good afternoon, Dr. Roussin. Diana from 680 CJOB. I am wondering kind of about the situation in Winnipeg. I know you mentioned community transmission is about 20% here, but people are wondering where the cases are coming from. How many are kind of linked to travel? How many are close contacts? And in the odd travel-related cases, where are those travelers coming? Are they interprovincial? Are they international? I know we're hearing a lot of people calling for kind of a reinstatement to mandatory self-isolation for anyone coming into the province. So just hoping to get an update there.
Yeah. So actually, I don't have all those specifics for Winnipeg. I know that we know that 80% are connected or are epi-linked somehow. The majority of those are through contacts of known cases. Province-wide, in the last 7 days, we've had 9 cases that are related to travel, but that's not necessarily specific to Winnipeg.
Thank you. And then, as for my follow-up, apologies if this was already asked. I couldn't quite hear super well. You mentioned that the changes with regards to self-isolation requirement being part of the public health order for close contacts. Can you give examples of situations that kind of you felt necessitated this sort of more enforceability to self-isolation?
Yeah, and so I think a lot of it was there are reports of it, so not necessarily something that public health necessarily confirmed, but really what concerned us in the Prairie Mountain Health region, especially in the Brandon region, was the amount of large gatherings that we linked cases to, and then reports of large gatherings that had people who should have been self-isolating in attendance. And so that's about the specific that I know, but that's what prompted us both to start looking at that in consideration with the increasing numbers in the region. Why we went to orange, and then this order is why that's why we necessitated this order here.
From the Winnipeg Sun, Scott.
Hi, Dr. Roussin. I mean, this is, again, I'd have to look back at the bulletins, but it seems lately that the information surrounding new cases has been less, and I'm wondering why that is. And I know Diana just asked about travel-related cases, but why do we seem to be getting less information about where cases are coming from?
Yeah, I think that the way we've been reporting is actually quite a bit more detailed than we have in the past, right? We're down to the health district level. So I'm not sure if you're referring to the providing the age and sex of everybody, every new case. I'm not necessarily sure that helps inform Manitobans if to know the specifics of each case like that. So I think the intent was to provide more information, and I think we if you look at the health district level, I think that's what we've done. So. We'll take a look and see if there's something more we can provide if Manitobans aren't feeling informed by it. But I think we've come a long way.
All right, I have a follow-up to that, but I won't ask it. I only got 2 questions. Second question is, people are wondering, when it comes to just mild symptoms, are we talking just respiratory symptoms? If somebody has an upset stomach, what classifies as a mild symptom? I guess that's like, what is a mild symptom in your mind?
Yeah, and I guess that would it depends on the individual, but from some of the cases that we see that report, just a scratchy throat, mildly scratchy throat, mild headache. And things. So we've seen people with just one symptom, sometimes multiple symptoms, but that they normally consider very mild. That if they got worse, got tested, and looked back, and in retrospect thought, I think I had that for a couple days. So it's things that are difficult to pick up on sometimes. So that's why we talk. Even if you have a mild symptoms, self-isolate, get tested.
From the Canadian Press, Steve.
Steve Lambert from the Canadian Press. Dr. Roussin, I'm just wondering, I know we always, you and other health officials always state cases are connected to nursing homes. Can we say whether these 2 women in their 90s were residents and not workers or relatives of residents, that sort of thing? Were both these women in Steinbach residents of the care home?
That's correct. Yes. Yeah, there were 3 residents that were identified as cases, and these 2 deaths are part of that.
Okay, thanks. And just wondering about enforcement of the new order that's going out, the new public health order for close contacts to self-isolate. It's my understanding that it's sort of reactive. You get reports that people are not self-isolating. So what happens then? Does a peace officer or a a designated health officer go to the person's home and issue them a ticket?
Well, yeah, this would be guided by medical officers of health. So they would be reviewing the case, and certainly, like we say, education is our number one tool here, because we know that there's a disproportionate burden on some individuals, with COVID and with lots of other illness. So for the most part, we're going to work with people to try to get them to self-isolate, support them, whatever they need to self-isolate. But there might be cases where we would issue this ticket, and that would only be done under the advice of a medical officer of health.
From City News, Jonas.
Good afternoon, Dr. Roussin. I just want to follow up on this 20% community transmission number. It's for Winnipeg, I know you said today, but if I remember correctly, this is similar across the province. And what I'm wondering is, how does this relate to other jurisdictions? Is there any data on this? Are we seeing more of this in Manitoba than other places?
You know, the problem with that is people have a different definition in other places. So, a number of places, they might report very high community rates, community transmission, in the 80s and 90s. But a lot of them will be, if a case transmits it to somebody, a household contact or somebody else, they might count that as community transmission. It's transmission that occurred, in the community. And so it's very hard to compare. So, typically throughout this, we have a very low rate that's reported, and it might be a bit of an artifact on how we measure it. We feel that if a close contact of a known case who now is self-isolating and becomes ill and has no other subsequent contacts, that's someone we'd want to distinguish between someone that we just test positive and they were out and about in the community.
And just to follow up on that, does the 20% number concern you based on what we know? Is it expected? I guess just kind of even anecdotally, what that tells you.
Yeah, I think that number, those type of cases are ones that we follow. Again, if we have if we report 4 cases in a day, and all 4 of them are from the same household, that's much different than reporting 4 cases that have no connections and weren't in contact with anyone that we knew of. So it is something that we follow, certainly the trend of that, so that trend hasn't been steadily increasing. It certainly has increased from our first wave that we dealt with the virus, but right now we're looking at it, we're not seeing a steady increase in that. So it's just another one of those important indicators that we follow.
From CHVN, Taylor.
Hi there. My question is regarding health region districts. Now, we see that health regions in other areas have districts, but for Winnipeg, which also includes Churchill, it's just one. Now, seeing as Winnipeg has a denser population, are there plans to separate the city into different districts?
So Winnipeg will have 2 districts, one for Winnipeg and one for Churchill, so we would be able to separate that out. We've considered breaking down Winnipeg more, but from a public health approach, it really doesn't add a whole bunch, right? Like, so when we talk about health districts, breaking it down gives people a little bit more view, but when we report cases, we report from their place of residence. And so if we break down Winnipeg into 4 or 5 different areas, that's where the person lives. So they might live in the north, they might work in the south, they might have family in the west. So, breaking out where the case lives doesn't necessarily tell us much.
And for particular areas of Manitoba, you are sending mobile testing. But what else is the province doing for people who want to test but don't have access to their own private vehicles, especially in areas where drive-in testing is maybe their only option?
Mm-hmm. Yeah, and I think that there's been a number of interventions, especially in places where there's higher risk, say like at shelters. We've had outreach testing in those areas. So we are trying to continually increase the access to testing. The outreach is certainly more feasible when we can go onto a tight geographic area and test a number of people there. So it's a real different aspect than sending somebody out to go test a single person. But we're continually looking at that. We look at ways to make it, more accessible for everyone.
Thank you, Doctor. We now return to room 68 for a couple of quick questions.
Cases at Bethesda, do we have an update on that? Is it 7 or 8?
Yeah, it's 8 now. We had another employee test positive.
So 5 employees, 3 residents.
And do you have an update on the cause? On Monday, you said you had a theory about extending the, perhaps, definition of the incubation period.
That's still the only exposure we can come up with. Employee that tested positive on the 3rd.
And can you clarify something about the exemptions on the new public health order? There is exemptions for for healthcare employees. What happens with children in schools? If somebody tests positive in a school and their entire cohort is exposed, will everyone in that cohort be required to self-isolate under this?
Yeah, it depends. So it'll be if the public health will do that investigation, and so it could include that entire cohort. We might be able to narrow it, but you will be informed by public health that you are a close contact of a case. And yes, all close contacts of cases, as informed by public health, will be required to self-isolate.
Couple more, please. And I've got a question for, you may be able to answer this, and I know you won't. Minister, is it true in the healthcare system, I've asked about the exemptions for medical reasons, if you opt out of the school year, will you be forced for the entire year to opt out and remain out? To your
Oh, I
knowledge?
don't have any information on that. That's probably a question best directed to education.
There's crossover, hence I. Okay, last one.
Dr. Roussin, on flu shots, we're coming into the flu shot season. There's been some claims made based on limited research that getting a flu shot could increase your chance of contracting another virus, like a coronavirus. Do you see any validity in that?
No, I think that
They call it virus interference.
Yeah, there's certain theories out there, and I think that a lot of the the underlying format of the studies have been questioned. So I don't think that should play a role in our response at all. Our advice is that every eligible Manitoban should get a flu shot this year, and then also in addition to that, all the typical fundamentals.
And when can that start? When are they available?
Yeah, it depends. We have our orders in. It's nationally procured. And so we tend to start receiving shipments, often near the end of September, October, but it's out of our hands when they actually come.
Probably October, and you've ordered more than last year.
Correct.
You're hoping for a 40%. You've ordered enough for 40%, but you may go higher if the demand is there.
If possible, yes.
Thanks, guys. Thanks for all that.